Welcome to the Guide to Wellness podcast. I'm your host, Susannah Freeman, licensed acupuncturist. In these conversations, we blend the wisdom of traditional Chinese medicine with the innovations of modern functional medicine, offering practical insights and tools for a life of wellness. Our vision is to contribute to a healthier world by providing accessible knowledge, tools, and daily practices. If you're ready to adopt new health habits and do things differently, then listen and learn here.
Hello, everyone. I'm Susannah Freeman, licensed acupuncturist, director of Guide to Wellness and Great Turning Healing Center. And here at the Guide to Wellness podcast, we have our very favorite Dr. Breana McElgunn, naturopathic doctor, otherwise known as Dr. B. She is jumping back into our studio once again, we love it, to chat about menopause, all things menopause. And I want to refer you all, please, back to our previous podcast episode where we talked about perimenopause. So we're talking about the seasons of life in the woman's body. It does have lots of impact and influence into the life of the man as well. But in these particular topics, we're simply talking about the female body. And stay tuned, everybody, for a really interesting conversation. Dr. B, I appear to have a muffin top.
Yes, it may be your hormones, Susannah.
Oh, my heavens. All right, let's go.
So, thinking about what's the difference between menopause, or how I like to be even more clarifying and saying it's postmenopause compared to perimenopause. As we talked in our first episode about perimenopause, a woman is still having menstrual cycles, even if they're irregular. Postmenopause is when that last menstrual cycle has stopped. And many times we don't know exactly when that last menstrual period will occur because we have to wait 12 months to say, oh, I guess that was my last period.
Right.
We're going to discuss some strategies in trying to use some testing to help us determine what that might be. So menopause, I think most people use that term to describe the hormone imbalances and the symptoms that they're experiencing once their periods have stopped. I like to reference that again and call that postmenopausal status as we think about the hormones and the symptoms that are different than in perimenopause. There are some similar hormones and symptom pictures, but there is a difference.
Okay.
The end of the menstrual cycle really signifies that the ovaries have become quiescent. That's one of my favorite words, which really means that the ovaries are now dormant and they are not manufacturing the hormones estrogen, progesterone, and testosterone like they used to in the past.
And there's a very specific blood test, right, that you use?
Absolutely. This blood test is called follicle stimulating hormones that is actually produced by the pituitary gland in the brain. And it's a way that the pituitary talks to the ovaries all throughout our menstrual life. FSH is the abbreviation. Now, when we are having menstrual cycles, the best time to measure FSH blood test is on day 3, 4, or 5 of the menstrual cycle, very early in the cycle.
Interesting. That's different than when you're perimenopausal and you want to test on day 19, 20, and 21.
That's when we're looking for progesterone
Gotcha.
levels.
Okay.
When we're looking at FSH as a blood test to determine if the ovaries are dormant before we reach that 12 months since the last menstrual period, the FSH blood test can be done also at that same day 3, 4, 5 if there is a period, but it also can be done if there's been no period for 3 months or 6 months.
Okay.
And if the FSH is above 30, that tells me clinically that the ovaries have gone into dormancy and their capacity to make the hormones, manufacture the hormones, is now done.
Okay. And the purpose of all this is simply to give information so that you can help the woman understand where she is in that cycle and also to recommend her best strategy.
Absolutely.
Okay,
we don't have to wait that full 12 months from that last menstrual period
that's a relief.
FSH helps to guide and direct our treatments.
So I'm going to be your patient here. Dr. B, oh man, I'm just not sleeping. I'm waking up at 3 a.m, throwing the covers off, and then sweating, and then I'm soaking wet, and then I go back to sleep, and then I wake up really cold.
That's a frustrating set of symptoms, isn't it, when our sleep is disrupted?
Yeah. And then, man, these old injuries of mine, and like these I keep having these different joints. My hands hurt, my feet hurt, my knees ache. And Dr. B, we talked about when I was perimenopausal, that menopausal muffin top and those 5 pounds around my middle, they're still not going away. And I have a really nice diet. You've been helping me with that.
Absolutely. So this is part of the evolution now that the ovaries have stopped making the hormone levels, and you're still struggling with those symptoms despite doing all of the intervention and eating well and self-care. This is how our body changes. Statistically, we're going to spend roughly a third of our life being postmenopausal. So we don't want to suffer with the joint pain and the weight gain and the sleeplessness for years and years into our, as we age in life.
Right.
So
can I jump in here for a moment? I am postmenopausal, so I'm not speaking as a patient anymore, but as somebody who's been through the process, I personally found that the perimenopausal time was more difficult before I knew what it was.
Absolutely.
And now I'm through it. I feel stronger. I'm more resilient. I recognize my body. I know my limits. I know what I can do. I'm actually really happy with where I'm at right now. And it's a really different thing, and I'm relieved to be done and have my life and my brain back.
I have had a number of women comment on that. When we take the ovary variability of hormone production out of the equation, because now they are dormant, there is more consistency.
Yes.
There's less highs and lows as hormones ebb and flow.
Right. That's a good way to say it. Yeah.
Because those ovaries are done producing the hormones. And then there is less of a wobbly foundation.
There were a few years there where I felt like I couldn't count on my body. I didn't know what to expect.
Absolutely.
Yeah.
Absolutely.
Okay. Good. Thank you. That's
so
helpful.
One of the things that also just really is something interesting to keep in mind is we can have estrogen elevations that our body can make in our fat cells, which adds a level of variability that's outside the ovarian production that's now dormant. And we can also have some estrogen elevations that can come from foods that we're eating. So we want to be mindful of our foods. And oftentimes those estrogen elevations can manifest in cardiovascular symptoms. So I'd really like to talk about some of our common symptoms that are now showing up in postmenopause.
Okay, what are those?
It is still possible for a postmenopausal woman to have some occasional bleeding. It's not because her ovaries are producing those hormones consistently, but it can be a little bit surprising. Maybe it's been 9 months, 10 months, or even 12 months, and a period shows up. Generally, that's not worrisome, and it's the body just flushing things out because it needs to. We can also see persistent hot flashes, daytime, nighttime. Our sleep can still be a problem. Vaginal dryness, as well as dryness in other places of the body. Dry skin, dry mouth, dry eyes, dry hair.
Yin deficiency.
Sensitive skin because of that dryness. Maybe fabrics from your clothing doesn't feel as good, or tight socks don't feel as comfortable. Changes in libido. We did mention that in our perimenopausal episode, but because of that vaginal dryness that is so common for some women, intimacy can become painful, and that also can influence desire declining. We can also
we can help with that.
Absolutely. And we can also see some of those persistent mood changes, anger, and joint pain, like we mentioned. Those fingers are stiff. Those knees are stiff. Maybe it's your neck. So that also is one of those symptoms that relates to dryness, but within the joints overall.
Once again, yin deficiency, and we'll talk more about that later.
And something that doesn't get a lot of collaboration or coordination with postmenopause is cardiovascular changes, and that might show up as changes in heart rate, typically an elevated heart rate, as well as changes in blood pressure. Oftentimes we're seeing blood pressure creeping up or being an outright problem with hypertension.
Yeah, I see that as well.
We can still have symptoms associated with these hormone changes, like, for instance, if we have low progesterone, again, common is we're going to see sleep issues, frequent waking, struggling to fall back to sleep, muscle aches. Progesterone is a great way to relax muscle fibers. And if we don't have enough progesterone, we can have much more muscle tension and muscle aches in our body. And then a general emotional tension. It's difficult to relax. It's difficult to feel comfortable and positive. That emotional tension or that tension that we hold in our brain is a common low progesterone symptom.
Okay. This is sounding a little bleak. Is there a way out?
Absolutely.
Or am I just stuck with this?
We're going to talk about some treatment strategies. Top 3 hormone symptoms when we have low estrogen in our postmenopausal status is we're going to still see some of those hot flashes. Oftentimes I see the hot flashes showing up more as a daytime problem than just nighttime like we might see in perimenopause. We can have dryness like we mentioned, all of those different places of dryness. A lot of dry eyes and dry mouth with women, and they're thinking, I'm just not drinking enough water. And in fact, it's not helping. And then also, again, the joint pain, the dryness within the joints. Statistically, frozen shoulder or dramatically decreased range of motion in shoulders is a common postmenopausal estrogen deficiency symptom that maybe isn't responding to exercise or massage or even physical therapy.
And then you throw in more of your wizardry and then the physical therapy or the acupuncture, whatever it is, but the collaborative approach will then
absolutely
a better outcome.
When we do the physical activity combined with naturopathic and traditional Chinese medicine treatments, that collaboration yields positive results much more quickly and lasting results.
Nice.
We can also have elevated estrogen even if the ovaries are dormant and we're in a postmenopausal state.
How does that work?
Sometimes those fat cells of our menopausal muffin top really step up and squirt out and manufacture all this extra estrogen. Or again, it can be dietary related as well.
So are you saying that my muffin top is because my body is actually sort of being intelligent about wanting to produce more estrogen?
Absolutely.
Tell me
It's
more.
a compensation mechanism that when our ovaries stop making those consistent hormones, our fat cells say, we can step up, we can help that estrogen. But those fat cells have to increase in size and they have to really become robust and big fat cells to be able to make that additional estrogen when the ovaries are not. So when we have high estrogen in our postmenopausal state, we're going to see that persistent weight gain or difficulty losing weight. You might now see it not just in the menopausal muffin top and the belly, but maybe it's showing up in the hips or the thighs or the legs.
Could it be, is weight gain only a high estrogen?
Absolutely not.
This is complicated.
We talked about hypothyroid and thyroid hormone decreases, as well as cortisol with our adrenal system in our perimenopausal episode, and how those also contribute to changes in the weight and not seeing the weight loss despite making good food choices or having good activity. 2 other symptoms I want to mention with estrogen excess in the postmenopausal state are edema. That edema, again, doesn't respond to compression socks or activity. It just tends to be holding on to that puffiness. And then also additional mood imbalances. Many times I mention to my patients that when we're in a postmenopausal states with high estrogen make us plump, juicy, and crazy. And I say that gently because we can see a variety of different types of mood, not just an irritable mood or a depressed mood or an anxious mood. We can see tearfulness. We can see melancholy, I like to call that the Eeyore syndrome, when we're somewhat melancholy.
Yes. And you could also have a relative abundance of estrogen compared to progesterone.
Absolutely.
Right.
That imbalance, that the estrogen is the dominant hormone and the relative imbalance of the low progesterone. So this is where we oftentimes employ hormone replacement to create a balance between those two hormones, because the ovaries are not able to do it any longer.
Cool. So, and we'll talk a little bit more about hormone therapy. In the meantime, I want to chat a little bit about how traditional Chinese medicine will explain these exact same conditions in the body, and they're going to use more of a metaphorical language to describe these changes. For example, and refer back again to the perimenopausal episode where we talk in more detail about the liver and the thyroid and the spleen and the blood. But specifically in traditional Chinese medicine, the kidney system, which includes the adrenals and all these hormones we've been discussing, the estrogen, progesterone, testosterone, cortisols. In Chinese medicine, the kidney system includes, metaphorically, this broad range or network of functions in the body and tissues in the body that includes ovaries, uterus, adrenals, spine and central nervous system, and the brain. And so menopause includes all of that, and bones. I didn't mention bones. It's all in the kidney system. So we're not talking about the kidney organ so much as the broader system of the kidneys as described in traditional Chinese medicine. So the yin, as in yin and yang, the yin of the kidneys is declining, and it's normal and natural. This is the cooling system in the body. We'll get to that in a moment. The cooling, nourishing, regenerative aspect of the body, whereas yang is the more metabolic, hot, active functions in the body. So the kidney yin is declining with this drop in hormones and ovarian production. And the best way to move through perimenopause and menopause, as you'll remember, is to have a happy liver system. So the regulation and processing, manufacturing, and getting rid of old hormones is working well. All those detox pathways are working well, right? And you have a smooth flow in your body. So in traditional Chinese medicine, the liver system, when that circulation or flow in the liver system is impaired, or we have stress, that can aggravate the kidney yin picture, and vice versa. So when you're menopausal, if you're stressed or fatigued or drinking a lot of alcohol, or you're staying up late and eating late, and things that can make the liver work harder, that's going to aggravate or worsen your menopausal symptoms that are happening in the kidney system. So we need to treat both. We need to treat the liver to make your ride more smooth. Okay?
Yes.
The kidney yin is what you're actually targeting. That's the root cause, the root pattern we're trying to nourish is the kidney yin. So, like we said before, it's best to treat the liver and to begin well before you hit menopause. So begin treating the liver in the decade of life in the 40s or so, even the 30s if you like. And then to remember that menopause is just this completely normal decline in kidney yin. It's like you're driving along on the highway and you're noticing the temperature regulator in your car starts to overheat. This is not a problem with too much heat in your car and the engine. The engine is overheating because you no longer have enough coolant. This is menopause. So you don't have a problem with your engine overheating. You have a problem with not enough coolant.
I love that analogy.
Yeah, it works really well, right? So if you're having a hot flash, it's because you don't have enough coolant. And then to take it a step further, you might have what we call liver yang rising, which is this yin is not anchoring yang. So you're not having this anchoring of that heat or restraining of that heat, and the heat is flaring up and causing you to be anxious, restless, angry, or actually sweating, when really what you need is more of an anchor. And we'll use Chinese herbs to help you anchor. So that's the lack of coolant in the car analogy with a deficiency of kidney yin. And as we spoke about in our last episode about the thyroid, how there's other legs of that stool that need to be in place. So the thyroid, if the thyroid is off or it's getting thrown off because of menopause, you might actually have a hypothyroid symptom, which then can be a kidney yang deficiency, and it's as if the furnace in your house is not working, so your house is cold. It's actually not a problem with your house, it's a problem with your furnace.
Like it's not for lack of insulation.
Yeah.
You're just not making enough of the heat inside the body.
So once again, it's this complicated picture that, thank heavens, we have people like you and me who enjoy this complexity, and we can help demystify it for our patients to understand what's actually happening. Please don't take it personally, right? Let's just isolate what is the root cause, what are we trying to change to help you generate more well-being and enjoy your life. So in this case, we're diagnosing based on, are you yin deficient? Does the liver system need help? Does your thyroid need help? Do you have a yang deficiency? The bottom line here is the kidney yin is dropping, but there are all these other pieces of the puzzle that might be coming into play that we also need to address.
It's a good reminder that, again, we're still doing testing and not guessing to employ a synergistic treatment approach.
And I know that you and I both use a lot of clinical exams and physical exams as well as labs to really understand. In traditional Chinese medicine, we use the tongue and the pulse and the abdominal diagnosis. Where in the body are you tense? Where in the body are you lacking in tone, in order to really understand what needs to create, what symptoms need to be addressed in the body, and how to create balance and well-being.
Absolutely.
So in order to actually generate a change here, often with menopause, because the ovaries are no longer producing, we do need to add into the system. So you may need more sleep. You may need certain foods. There are lots of lifestyle changes that we can make that will help support the menopausal process or support you once you are actually menopausal. So remembering that menopause is a normal decline in the kidney yin, and that there's this broad constellation of symptoms that can happen in and around that decline in kidney yin, we're going to use Chinese herbs and nutrition and lifestyle strategies to support that whole process. And there are very specific herbs that we use depending on your symptoms. Some of those are very well known and you might recognize the names. These are all Chinese names. Zhibai Di Huangwan. One of the most famous Chinese herbal formulas ever is called Free and Easy Wanderer. That smooths out the liver. Erzhiwan is a beautiful, simple formula with just 2 herbs that helps balance menopausal symptoms really, really nicely. There are lots of nutritional strategies that we also use. Let's say you have that 5 to 10 pounds or maybe even more of weight gain that Dr. B was chatting about, and I was pretending to have as part of my patient example here. We might have you use time-restricted eating and fasting overnight for a certain number of hours and then eating during a certain window to stabilize your blood sugar and have that support your nutrition. We may be encouraging you to eat lots of clean fats to support brain health and blood sugar stabilization. There is a beautiful fasting mimicking diet system that we use made by a company called Prolon that will help decrease some of those 5-10 pounds and help your brain stay more focused. And that's something that you can do lifelong. It's a beautiful nutritional strategy. We're going to have you make sure that you're staying hydrated and eating lots of dietary fiber. And we definitely want to make sure that you're balancing your blood sugar with the foods that you eat and what time of day you eat.
Even with all of those strategies that we're employing, Chinese herbal formulas, nutritional strategies, women can still experience worse symptoms, the onset of new symptoms, because again, the ovaries are dormant. They're not making the hormones. And this is where, again, collaboration becomes really, really important. One of the things that I get lots and lots of questions on is hormone replacement. Hormone replacement is useful for a number of women. It's also very important to recognize the type of hormone replacement we might use. Again, in collaboration with all the things that we've been using and building on. And sometimes, despite all of that, we still need the hormone replacement. Again, we touched on it in our perimenopausal episode. Bioidentical hormone replacement therapy uses a plant source to then create in the laboratory the estradiol, the progesterone, the testosterone, DHEA or cortisol or pregnenolone to be identical to those molecules that our bodies make, so they can bind easily and quickly and readily to the receptors within our body. It's also very important to know that we're using physiological doses below what someone might have used in their 20s or 30s if they were taking a birth control pill or just the natural production of their own hormones. I am not a fan of using single bioidentical hormone intervention.
Interesting.
I like to use them in combination, and that might look like using both estrogen and progesterone. That might look like progesterone with DHEA. That also might look like DHEA with thyroid hormones. So using single individual hormone intervention oftentimes creates side effects as well as unwanted effects of having too much of that medication.
And we might also use Chinese herbs to minimize or balance that hormone replacement therapy.
We also think about what women may not be eligible for bioidentical hormone replacement. This might be a woman who has had a cancer history.
Yes, for sure.
Or blood clots, or even problems with high blood pressure that can create some unwanted effects. So again, I look at testing as well as each unique woman's presentation and what she's already doing to help support this transition.
And so if she's not a candidate for hormones, then you're going to focus on possibly maybe some DHEA if the lab tests show that it makes sense for her, or you're going to focus more on nutrition, making sure that she's getting enough sleep, building that yin. That's when you might be sending your patient back to me to give Chinese herbs.
Absolutely. So I like to prescribe certain dietary interventions, not just a whole foods diet or timed eating, fasting, but thinking about soy. Maybe some of you of our listeners are thinking, oh, soy is not good or soy is really good. Soy is therapeutically beneficial for helping to minimize or manage hormone fluctuations when we eat the right types of soy. I like to emphasize organic soy and non-GMO soy sources, as well as fermented soy sources, which includes tofu, miso, really good soy sauce, and even tempeh. Soy sources like soy milk or soy yogurt or soy ice cream are not fermented and thus provide less benefits as we look at how soy can help create stability with our hormone receptors on the tissues of our body.
Well said. And don't forget to eat your broccoli.
Yes, the cruciferous vegetables provide additional sulfur-containing vegetable compounds that really help our liver. There's that liver again, to help break down our hormones, to help detoxify our body, as well as providing much-needed fiber for our digestive tracts.
So fats, fiber, vegetables, water. Yep, this can actually go a long ways. And then we get a little tired of hearing the importance of a healthy lifestyle, but you know what? Actually, it's really that important. And getting regular exercise, it does not mean you need to be a triathlete, but the importance of muscle strength and weight resistance is super, super important as we age.
Being consistent with activity, even if it's 15 minutes of walking, but you do it every day. Consistency is really important.
Yeah, and then throw a few push-ups or squats in there, right?
Yes.
Okay, perfect. So that is the most important thing to think about, is that foundational nutrition and that self-care with sleep, exercise, a well-balanced diet that makes sense for you. And then we're going to add in the herbs, the Chinese herbs, the Western herbs, and if it makes sense for you and your body, you're going to add in some hormone replacement therapy, and then I'm going to fill in the gaps and the symptoms and work on the implementation and really think about the longevity of that person and how to think ahead with brain health and muscle strength and balance and coordination and sleep and preserving that yin that we talked about earlier, so that you have the energy and the vitality to continue for that last third of your life and to make it as the best ever.
Absolutely.
It's really cool. So menopause is not a disease. It's normal. It's a lovely time of life.
We're not trying to cure menopause. We're trying to maintain and promote the wellness as you are aging gracefully and doing it with vibrancy as well.
Yeah. And I like to think about how important our elders are with young generations and as leaders, and keeping people's brains focused and sharp and their joints healthy so they can stay active is just what people want. So the trick is to start early and to make sure that you have a team that makes sense to you and is working in a proactive way to help you stay happy and well through your years, and that postmenopausal is not the end, it's just the beginning in some ways. Huh?
Absolutely. Well said.
Thanks, Dr. B. Love having you here on this show.
Always a pleasure, Susannah. I look forward to the next time we get to collaborate on a podcast.
Thank you. Thanks, everybody, for listening. Please let us know what you want to hear next.